So we're going to talk about a very important drug, which in the US is called epinephrine, and in the UK and other countries it's called adrenaline. Generally, so the dosage for the drug in adults for intravenous method of giving the drug. So in advanced cardiac life support, we start with 1 milligram. Okay, so it is this is of a 10 mils. Okay, so 1 milligram is 10 mils of a 1 to 10,000 solution, and we might repeat this dose 10 mils as often as every 3 to 5 minutes throughout the process of resuscitation. So when we are resuscitating a patient, so we might give 10 mils every, say, 5 minutes. Okay, repeat 10 mils and then 10 mils and 10 mils, which is 1 milligram. For endotracheal doses, can give 2 to 2.5 milligrams every 3 to 5 minutes. So again, 2 milligrams after 3 minutes, 2 milligrams after 3 minutes, 2 milligrams, or after 5 minutes, 2 milligrams. And in anaphylactic shock, okay, so as a 1 to 10,000 solution, so we give 5 mils infused, okay, infused slowly until we see a response. So I can also give intramuscularly in anaphylactic shock, also as a as a 1 to 10,000 1 to 1,000 solution. So for this one we give 0.5 mils, okay, because this is more concentrated, so we give a 0.5 mils and repeat every 5 minutes when necessary. So we can give 0.5 mils, and then after 5 minutes another 0.5 mils, and after 5 minutes another 0.5 milliliters. And then for acute asthma, we can give intramuscularly or subcutaneously. So this is as a 1 to 1,000 solution. So we give 0.3 to 0.5 mils of adrenaline. And for metered dose from, so the every metered dose from the pressurized aerosol contains 160 to 275 microgram of epinephrine. So in this case, we give 1 to 2 inhalations, okay, 1 to 2 inhalations of epinephrine or adrenaline. So this is an acute asthma. So the indications are as I mentioned above. So we have the advanced cardiac life support, okay, anaphylactic shock, and also acute asthma. So these are the main indications to give patients with adrenaline. So notable contraindications. So when do you not give adrenaline, or when do you try to avoid giving adrenaline? So firstly, when you have patients with pre-existing hypertension, so they have a known high blood pressure. Secondly, in occlusive vascular disease. And then you have angle closure glaucoma, when you have your intraocular pressure increased. So this might cause blindness, so you don't want to make it worse by giving adrenaline. And then in hypersensitivity, so when you are hypersensitive or allergic, when you have allergy to adrenaline, so you would like to avoid giving adrenaline. And then in cardiac arrhythmias, okay, abnormal rhythms of the heart, or when you have tachycardia, your heart rate is high above normal when used in addition to local anesthetics. So you have to avoid, okay, when there is adrenaline in the local anesthetics. So you would like to avoid this adrenaline when you do procedures involving the fingers, digits, ears, nose, penis, or scrotum. Okay, so this is very important to take note. So if you are giving a local block to someone, um, for a procedure involving the fingers, ears, nose, penis, scrotum, you would really think hard before you start giving that injection that contains epinephrine or adrenaline. So precautions, be careful when giving patients adrenaline if they have cardiovascular diseases, they have high thyroid levels, diabetes, mellitus, Parkinson's disease, and also in the elderly. So what are the unwanted effects of adrenaline in patients? So you might see central nervous system effects, gastrointestinal disturbances, you might have epigastric pain, pain in the tummy, cardiovascular disorders. If you have already problems with urinating, problems with peeing, so you might have difficulties further in micturition, in peeing, dyspnea, okay, shortness of breath, hyperglycemia, your glucose levels go high, sweating, hypersalivation, so your saliva keeps coming out. You have drooling, weakness, okay, you might get weakness, you might get tremors, you might have coolness in the extremities, potassium levels would go low potentially, and when given to in addition to local anesthetics, okay, you might get gangrene, tissue necrosis, okay, you might get sloughing. So these are things that might happen, even though it's usually not highly anticipated, but this is what is potentially something that potentially can happen when we give adrenaline. Interactions. So interactions is mainly interactions with other drugs. So it might interact with halogenated inhalation anesthetics. You might have problems when you give together with beta or alpha blocking agents. When you're given with methyl-dopa, an antihypertensive, guanethidine. When given, adrenaline is given together with drugs with vasoconstrictor, okay, constrict the vessels and press the effects. Antihypertensives, okay, because so you might want to be careful when you give adrenaline with antihypertensives and then with adrenergic neuron blockers. So the potassium depleting drugs, okay, drugs that causes loss of potassium. So you have to be careful when giving this kind of drugs together with adrenaline. Cardiac glycosides like digoxin, ephedra, yohimbe, and then tricyclic antidepressants may induce hypertension and arrhythmia. Okay, tricyclic antidepressants may induce hypertension and arrhythmia because these are all drugs that potentially can increase further the levels of the catecholamines. Okay, and that will increase the blood pressure and also cause abnormal rhythm of the heart. So basically, when we talk about the um, when about adrenaline, so with regards to pregnancy, it is considered category C, okay, C, which means that it is a drug that we, if possible, we would like to avoid unless the benefit outweighs the risk. Okay, so that's the U.S. FDA, United States Food and Drug Authority categorization. So based on that FDA categorization for adrenaline, epinephrine, so it is category C. Okay, category C, meaning that we try not to give, but then if okay, let's revise what is category C. So category C means either studies in animals have revealed adverse effects on the fetus, okay, on the growing baby, either causes teratogenicity or it causes the embryo to die, embryocidal or others. Okay, and there are no control studies in women, or studies in women and animals are not available. Okay, so there are no control studies in women, so means that yeah, it's difficult to study drugs in women who are childbearing or they are really pregnant. So it's difficult ethically to do such studies in human beings, or studies in women and animals are not available. So meaning that we studies have not been done in women and animals, so we don't have the available information with regards to whether this drug causes any problems or not. So basically, category C means drugs should be given only if the potential benefit justifies the potential risk to the fetus. Okay. So with regards to adrenaline, of course, most probably in in situations where you have to give adrenaline or epinephrine, it is unlikely that the benefit does not outweigh the risk. Okay, so most likely when you have to resort to giving epinephrine or adrenaline, the benefit or the pros outweighs the cons in most cases. Okay, if not all cases. And with regards to lactating women, we don't have enough information on that for epinephrine. So that's all from me. See you people in the next video. Thank you.